If we talk about the lumbar plexus, it is one of the most intricate and complex structures in the human body. The lumbar plexus is located in the lumbar region, within the substance of the psoas major muscle, and anterior to the transverse processes of the lumbar vertebrae. In other words, the lumbar plexus is a nerve network that starts in the lower back, emanating from the spinal cord. It extends towards the legs and supplies motor and sensory innervation to the lower abdomen, pelvis, and legs. Before talking about the branches that stem from this plexus, we shall look at the anatomy of the lumbar plexus. As I said, the lumbar plexus is formed by spinal nerves. If you are unfamiliar with the neurological anatomy of human body, you may be wondering, what are these spinal nerves that I'm talking about? Well, the spinal nerves are a group of nerves that originate from the spinal cord, which is a long tube-like structure that runs from the brain down through the spine. These nerves exit the spinal cord through small openings called intervertebral foramina and extend to various parts of the body, such as the arms, legs, and torso. In the case of the lumbar plexus, the spinal nerves involved are L1, L2, L3, and L4. The spinal nerve L5 may or may not converge with the other nerve. It is mainly considered to be part of sacral plexus. The spinal nerves L1 to L4 converge and form the lumbar plexus. This network is responsible for providing nerve signals to muscles and skin in the lower abdomen, pelvis, and legs. Something to note here. The first lumbar nerve, L1, receives some additional input from the subcostal nerve, which comes from the thoracic region of the spine, that is thoracic spinal nerve T12. So, you may find this illustration in some medical books. That is slightly different from the we will be focusing on in this video. Likewise, the fourth lumbar nerve, L4, gives some of its fibers to the lumbosacral trunk, which is a nerve pathway that connects the lumbar and sacral plexuses. Here you can see that in this illustration, the two plexuses are merged together. That is why both collectively are called lumbosacral plexus. The anatomical structure of the lumbar plexus is divided into two divisions: the anterior and posterior division, also called ventral and dorsal divisions respectively. Here in this illustration, the lighter area or pink area depicts the anterior division, and the darker or green areas show that it's the posterior division of the lumbar plexus. We can also look at it this way. The anterior division consists of motor and sensory nerve branches that innervate the anterior muscles of the thigh and the skin overlying this region. The posterior division consists of nerve branches that provide sensory input from the skin and deep structures of the posterior thigh and the leg, as well as controlling the tone and reflexes of muscles in this area. While the primary function of the lumbar plexus is to provide motor and sensory innervation to the lower limb, the lumbar plexus does supply areas other than the lower limb by sending nerve branches to other regions of the body. For example, the lumbar plexus sends branches to the abdominal muscles and skin, the genitalia, and the hip joint. It also contributes to the innervation of the diaphragm, which is the primary muscle used in breathing. So, to sum up, the lumbar plexus starts with four spinal nerves, L1 to L4, that come together to form a complex network of nerves that are divided into anterior and posterior division and control, transmitting signals to various parts of the lower body. Moving on, I will now talk about the branches of the lumbar plexus. Let's label them one by one. This is the iliohypogastric nerve. This nerve is formed by the merging of T12 and L1 spinal nerves. Next up is the ilioinguinal nerve. It branches off from the L1 spinal nerve, as you can see here. Next up is the genitofemoral nerve. Its nerve root value is L1 and L2. This nerve supplies the genital and inguinal areas. Here you can see the lateral cutaneous nerve of the thigh, stemming from the posterior division of the plexus. Its root value is L2, L3. This big nerve is the femoral nerve, an important nerve of the lower limb that passes through the anterior compartment of the thigh. From the roots of L2, L3, and L4, the branch called the obturator nerve originates. Lastly, this is the lumbosacral trunk that we briefly talked about before. The lumbosacral trunk is formed by nerve fibers from the 4th and 5th lumbar nerves, L4 and L5, as well as some fibers from the 1st sacral nerve, S1. These fibers come together to form a single trunk that descends towards the pelvis. Out of all these nerves that I have labeled here, I will talk about the femoral and the obturator nerve later on in the video, as these are the main nerves of the lower limb. However, as you have learned, the lumbosacral plexus does not only supply the lower limb but also the abdominal and pelvic region of the human body. For example, the iliohypogastric and ilioinguinal nerves. Both originate from the lumbar plexus and pass over the quadratus lumborum muscle, which is a muscle located in the posterior abdominal wall. Their course is similar as they travel together, as you can see here. If we talk about the function of these nerves, they provide both motor and sensory innervation. Both these nerves are primarily responsible for providing motor innervation to the internal oblique and transversus abdominis muscles, which are important muscles that help support and stabilize the abdominal wall. In addition to their motor functions, these nerves also provide sensory innervation to the posterolateral skin of the gluteal region, superior anteromedial thigh, and the skin of the pubic area. When these nerves are irritated, compressed, or damaged, it can result in pain in the distribution of their sensory branches, such as in the region of lower abdomen, pubic region, groin, upper buttock. It can be due to nerve injury or entrapment. Let's look at some other branches of the lumbar plexus. Another branch of the lumbar plexus is called the genitofemoral branch. This nerve is composed of two parts, or you can say it gives of two branches called the genital branch and the femoral branch. The genital branch arises from the first lumbar nerve and provides sensory innervation to the skin of the scrotum or labia majora in males and females, respectively. The femoral branch arises from the second lumbar nerve and provides sensory innervation to the skin over the anterior thigh, near the femoral triangle. It also innervates the femoral artery and vein and the hip joint capsule. The motor supply of the genitofemoral nerve goes to the cremasteric muscles. These muscles produce the cremasteric reflex in males. When this nerve and its branches are irritated, compressed, or damaged, it can result in pain in the sensory distribution. If the genital branch is injured, it causes pain in the region of pubis and groin. Pain due to femoral branch originating from the genitofemoral nerve is commonly experienced as localized pain in the front of the thigh. The skin on the upper anterior thigh, specifically the area supplied by the femoral branch, may be the site of discomfort. Another nerve called the lateral cutaneous nerve of the thigh originates from the lumbar plexus. It enters the thigh at the lateral aspect of the inguinal ligament. This nerve has a purely sensory function. After entering the thigh, it provides cutaneous innervation to the skin. The nerve innervates the anterior and lateral thigh down to the level of the knee. Entrapment or injury to the lateral cutaneous nerve of thigh causes a condition known as neuralgia paresthetica or lateral femoral cutaneous nerve neuralgia. It is characterized by symptoms such as pain, numbness, burning, coldness, muscle aches on the anterolateral aspect of the thigh. We will talk about the anatomical basis of neuralgia paresthetica in detail in a separate video. That is all about the lumbar plexus. I taught you about these 4 nerves that branch off from the plexus. Let's move on and look at the 2 major branches of the lumbar plexus in detail.
Discover a wealth of accurate, up-to-date medical videos for in-depth learning, anytime, anywhere. Elevate your medical expertise with sqadia.com.